Let's get started. Welcome to our Path 2018 kickoff of our Leadership Learning and Action Network. So today we're going to be talking about the importance of a strong culture and joy in the workplace. We are very privileged to have Dr. Royer joining us again, and I'll turn it over to him in just a minute. Our agenda for today, it is a packed 60 minutes. So previous LAN sessions were 90 and we've reduced those to 60 minutes. Right after our introductions, I'm going to turn it over to Jonathan Merrill and to Jade Perdue, and then we'll hear from Dr. Royer. We have a brief breakout room activity. All of our breakout rooms will be facilitated by one of our PATH project managers, and that'll take us about 15 minutes, and then we'll come back together for quick report out and next steps. My name is Dion Phillips. Again, I am your host today. I am trying a new headset, so I'll be listening to hear if it's poor sound or I'm getting any feedback. So please let me know that in chat and I'll try to adjust along the way. Also, as co-host today, we have Silke Bletzer. So if you need anything, please reach out to Silke or me in chat and we'll be happy to help throughout the presentation. I'm going to turn it over now to Jonathan Merrill, who's our Acting Deputy Director for Quality Healthcare and Indian Health Services. And Jonathan, go ahead and unmute, and you have the floor.
All right, how's my audio, Dion?
It's pretty good. You're a little soft. If you can speak up just a touch.
Okay, well, good morning and good afternoon to everyone calling in from across the country. It's a great time in Indian country. I think that as I was reflecting on the Leadership Action Network from last year and looking at the great outcomes of the PATH partnership, I really had to reflect and just, you know, I wanted to say a special thank you to our PATH partners that are on the call. I know Jade Perdue is on, Silke, Dion, and many others that have helped support this, and then a special thank you to our staff across IHS. I think we've all had to learn how to work together, how to align with strategic objectives and initiatives that are underway. And I just want to thank everyone on the call and just encourage everyone as we move into the 2018 our 2018 projects. Let's continue doing that good work. Let's have dozens of presentations that go to the CMS Quality Conference next year. I know we had a host of very nice projects that were presented at this year's last year's CMS Quality Conference, and let's strive for more of those and more great work and that showcase our improvements of patient safety and quality across the agency. I know that Dr. Royer is going to be talking about culture, and I'll just remind everybody. I think we've said this several times on many of the LAN calls last year, but you know, remember that organizational culture changes through the introduction of structure and methods. And much of what we're doing and what we're driving are redesigns and designing new parts of our system. So whether that's redesigning processes, designing new systems, implementing new software, that's the work we're doing that helps drive that culture. And Dr. Royer is going to
Artemis Morales, extension 8440, Artemis extension 8440.
Okay, thought someone. You know, I wanted to start highlighting, you know, also some of the quality improvements we've seen across the IHS in the last year, and I started jotting down a list of things, and it quickly became a front and a back page on a piece of paper, and I had to stop. But you know, some of the things that have come with our PATH partnership, but not to mention the projects, but you know, the multiplying effect that we're going to get after we've seen almost 4,000 of our staff in IHS completing or our staff in IHS completing almost 4,000 IHI open school courses. those are investments in our people and investments in our system that will continue giving us a multiplying effect. You know, this past year we've implemented a nationwide credentialing and privileging software solution, and we've done that in only 8 months. And hats off to everyone that's been involved in that. We've also got the new credentialing and privileging policy that's coming online. We've got the National Accountability Dashboard for Quality that we're already seeing that dashboard and those metrics that are driving some policy decisions and are driving strategies and initiatives at an area level. So I'm really happy with that work. We've seen, you know, great improvements occurring at some of our service units that have found themselves struggling over the past several years. We're moving into much better places with those facilities. If there's anyone from Rosebud Service Unit on the line, you know, Rosebud is now fully compliant with CMS. They're going to be undergoing a Joint Commission full hospital accreditation survey this spring, and they're back on a path to great success. We've got Pine Ridge on a path to success, and some of those other facilities that have struggled, I think we're seeing successes. We've got on the line our new Director of Quality Management for the agency, Dr. Julie Sadovich, that works out of the Office of Quality. And we're going to see more positions being advertised this spring for the Office of Quality, and be building this office to better support IHS and Indian Country. We're rapidly closing many outstanding quality-related GAO issues. Some on the phone may or may not know about those, but there's a dozen or so issues that have been kind of hanging over our heads for many years that we're finally getting ahead of. We've published wait time standards, and we're making EHR changes to better support data input through the user interface so that we can get some good apples to apples comparison around patient wait times as we move to national level reporting. And you know, we're seeing great partnerships, and as of June, we're going to have over 500 staff that have been trained in infection control skills in partnership with the Centers for Disease Control. Many of you guys have been involved in those. We've got the master national accreditation contracts that many sites are already participating in between IHS and the Joint Commission and with AAAHC. And I'd encourage everyone on the phone, as you're due for accreditation survey, please jump on the national contracts. That's allowing us the ability to trend survey-related findings, to roll up performance data that may be submitted. An example would be, you know, older ORIX measures and their replacements, and we'll be able to roll those up. And you'll also get the opportunity of purchasing those services with using the economy of scale of all of IHS. We're gonna see an update to the Websident replacement coming probably summer of 2018. We all know that's an antiquated system that really done a great job during its eras, but we need something that can get more robust analytics out of and be useful for making improvements and increasing safety. And generally speaking, we're going to see dramatic improvements to performance metrics and analytics across the agency, both in way of our PATH and QIN partnerships, but also in the purchase and the rollout of ClickView and ClickSense as we can move that implementation across the agency in 2018 and 2019. So I just jotted a few of those things down. It seems like an exciting time. And I'm hoping that the field is, I hope you all are starting to feel the effects of some of the improvements and the support and the tools and some of the methods that are coming out. I'd encourage the ongoing participation and the you know, test the practical application of the tools that come through the Leadership Action Network. I know much of what we've taught seems to be theoretical, but it's really up to us to turn it from theory into practical application and using and coaching and reinforcing our use of some of the practical tools that we learn. So don't be afraid to test. Don't be afraid to experiment with new tools. And I really look forward to 2018. And thank you all for participating and attending and applying the tools. Thank you.
Thank you, Jonathan. If you do have any questions for any of our presenters, please put those in chat. We'll hold them until the end, but we will try to get to all of them. And minimally, we will take note of those and respond back to folks and give an update to any of your questions for our next LAN. I will turn it over now to Jade Perdue. Jade, of course, is our Director of Quality Improvement and Innovations Model Testing at CMS. So Jade, you have the floor. You may have to unmute. I probably muted you.
Can you hear me now?
Yes, we sure can.
Okay, great. I'm just going to, thanks so much, Deanna. I'm going to pick up right where Jonathan left off and start out by saying thank you to everyone for being involved in the PATH work. And I'd particularly like to give a shout out to all of the leaders who participated in the CMS Quality Conference. I want you to know that I am still buzzing from that interaction that we had late on day 2, where we talked about what was working well within your system and how we might take what we're learning from people who are experiencing success and spread that rapidly across the system. So thank you so much. I'd like to, just again, picking up on how we here in the quality improvement area of CMS work, begin by extending an offer to you. I know that you are working fast and furious and testing small tests of change and setting the tone for all of your participants. And if there are conference calls or meetings that you are having, and that's something that we can support you with by providing insights around quality improvement or talking about best practice, that's something that we would love to do. And so you need only reach out to the PATH team to help us make that connection. And I just want to pick up on the topic of joy in work and what we are observing here in CMS. My area works with over 4,000 hospitals, acute care hospitals from across the country, is that joy in work is so important for reducing burnout, and we've all felt it. We all know what burnout feels like when we go for sustained amounts of time, working at a very high level, and in some cases maybe not making very much progress, and that can lead to burnout. One of the key things, and I hope Dr. Royer is going to touch on this, and I'll assert my bias here, but one of the key things that we are observing, and which is well documented in the literature about creating more joy, is aligning with purpose. And I think that's a very unique role of leaders in any organization, but particularly in healthcare organizations, where we can talk about what we stand for, we can measure what we stand for, and then we can help like-minded individuals get on board and find purpose and hopefully make that connection between purpose and the joy in work. So I just want to leave that with you, and hope that we'll have a more opportunity to engage in the coming months, and look forward to being with you on these Learning and Action Network events. So Dion, back to you.
Thank you very much, Jade. I'm going to keep us rolling so we're aligned to our agenda as close as possible. All of our resources, the links that we've shared, any pre-reading, the link to our recording will be available on that PATH resource page. We have redesigned that so it's a little bit easier for folks to use. And as we go throughout our LAN events throughout the year, It's that one-stop shop. If you go to that healthinsight.org PathLAN website, you'll be able to see all of the resources, and we will just add to those. I did see in chat a request for another resource, and so that's where you'll find that, and we will post it for you. Dr. Royer, he was part of our LAN in 2017 and did our last 2 sessions. So Dr. Royer, I think most of the folks know you, but if you wouldn't mind giving a brief introduction for yourself, and then we'll show your slides for you, but we are ready for you. You have the floor.
Thank you very much, and you can get up the slides. Clearly, I am honored to be here today. I have started my career in medicine many, many years ago. I've been in healthcare for over 51 years, have a lot of on-ground experience, both clinically and in leadership. And hopefully by participating in these LANs, I can add to the learnings that your 2 first speakers talked about. So indeed, each time you are enhancing your toolbox and actually getting better and better in your leadership competency. So thanks for having me, and we can go to the first slide. As you know, this session is following the 2 that I did at the end of the year, and I think those dots connect very well. Remember, I talked about the 3 critical attributes for all leaders, and particularly those in the Veterans Administration and Indian healthcare for Native Americans. I think you are the highest priority for us in improving healthcare. And I talked about making sure you're competent, making sure you're committed, and describe 3 ways that you can improve your passion. Then the second one was talking about knowing is not enough, but implementation is key. And as Mr. Merle indicated, you must implement what we are teaching and learning, and hopefully you can do that, and the breakout groups will help you understand that. Today, as we speak about culture and we speak about joy in the workplace, I want to review very carefully the why is this important, and then also what does it look like. And then hopefully you can take an opportunity to review where your organization and you are as an individual. How does your culture and your joy seem in relationship to what I'm sharing? The next LAN will be on how do you do it? How do you improve the culture and joy in the workplace? Because culture, I have always defined as the soul of the organization and its people. It's where the love of your work lives. And your internal culture, actually, that which in your organization and you becomes your brand externally. It's what people see, it's how they brand your organization, and how they brand you as a healthcare employee and a healthcare partner. Many people have said for years that culture trumps strategy, and I think we all agree with that if your culture is not embraced by the staff and is not vibrant, clearly any strategies and tactics you put into place, I don't think will be implemented. And if they're implemented, I do not think they will be implemented well. But based on my over 50 years of experience working with multiple teams, multiple organizations, and now with you, with this great honor of working with the Indian Health Service, I have determined that creating a strong culture is not accidental, but it must be intentional. You must understand it and you must work on it. Because if the culture goes away, your organization is going to be weak, your brand then will start deteriorating, and eventually your products will become unrecognizable. And that's why when CMS comes in, I think they recognize things that are not good as your brand has deteriorated. And clearly, there is no question that a joy in the workplace is absolutely driven by a thriving culture. Next slide, please. Certainly, I have always agreed and supported to my teams, you cannot give away what you do not have. You can't do that in your personal life. So how in the world can you do it in your professional life? But a workplace that is filled with joy is a workplace filled with hope, confidence, quality excellence, safety, and then competent staff, as we talked about at the last meeting. And then, in order for your patients, who are the most important items and the most important group in what we are doing, if we can't care for our patients well, then our mission of who we are, our vision of where we're going, and our values of how we get there will never work. And so for our patients to receive the highest quality, safe care that's most accessible, which I know you're all now monitoring and measuring, they must be served by you, a workforce that feels hopeful, confident, and most of all, safe. Clearly, we heard when we were in some of the facilities about the concern of retaliation, of bullying, of violence in the workplace. And those are absolutely deterrents to creating a positive culture and a hopeful, confident, and safe workplace. Hence, joy in the workplace is essential to promote healing, because if you are not joyful, you can't give it away to your patients who deserve the highest and best quality of care. Next slide. Certainly, what does a culture look like that is filled with joy? And I want you to concentrate on the next several slides, because these are the signs. We know why we need it now, because we can't care for patients if we're not filled with joy ourselves, if the culture is not joyful. So how do you see it then if it is joyful in your workplace? Because this is what you need to look at to determine where your organization is. People are growing and developing. They're getting more confident. The staff greets each other. And we talked about in organizations, when you pass each other, we find that some people don't even say hello to each other. Well, obviously, that is not good. There's a high level of trust. And so we're willing to follow our leaders because we trust them. The staff talks about the positives in the workplace, and then they get out in the community and they talk about it, because clearly there are things that people are not going to like that we're trying to improve. But I think you have to also talk about the positives that are occurring. The staff encourages their friends and their colleagues to apply for positions. Come work for us. Come work in the Indian Health Service. It's a great place to work. It has a great culture. It's filled with joy. Is that what you're saying when you're out in the community? And certainly, I'm going to review some others that will be reviewed in part 2 of the LAN, what other things will look like. Next slide. Certainly, now that we know why we need joy in the workplace in order to give good care to our patients, and then what are some of the signs of it, what are the essential components of this culture that I'm talking about that provides the foundation for this joy? Well, first of all, it's the values. Certainly the mission, who you are, the vision of where you're going have to be lived daily experiences. But how you get there also has to be lived. You can't say you're a trustful organization if no one trusts you. You can't say you're an excellent organization if that's not the journey you're on. You can't say you're an honest organization if you're not transparent. So I want you to all look at your values and say, are we living these out as daily lived experiences? The lack of credibility of leaders and of staff in all health systems in my years of experience have come from the fact that people do not walk the talk. They actually talk the talk, but they do not walk it. And therefore, this leads to the accountability of the staff. Is the staff accountable to live by these values? And are we measuring that through written performance expectations? Do we do metrics of success in everything we're doing with our strategies and tactics? And do we have an accountability matrix with timeline for completion? I recently had the opportunity to work with one of your facilities, putting together with a team their strategic plan for 2018 to 2020. And I was so pleased when I reviewed it last evening in draft form. They have it now with an accountability matrix. And that's the greatest assurance that things will get done. Then this environment of transparency. Who are we? What are we doing? Are we telling people exactly where we are, even if the numbers are not where we want them to be? Because it's this honesty and transparency that causes people to trust each other, gives us the motivation to continuously improve, which we have to. The journey to excellence is called a journey because you never get there. It is always a journey, and once you get there, it is even hard to sustain. But I will tell you, without honesty, mediocrity is often the outcome, and I've shared with many of you already, mediocrity and the tolerance of it stands in the way of excellence. Next slide. The other components of the culture are the authenticity of the board, physicians, leadership, administration, and entire staff. I already talked about this. Walking the talk. Don't be arrogant. We as physicians often are arrogant because we think we know everything. And clearly, good physician leaders can be outstanding leaders and can partner with you. But we must not be arrogant, and we think we're better than any other member of the team. And as I talked to you last time, you must be competent. Do you have the competencies to take the journey forward? Are you committed to yourself and your team? And are you passionate? Do you believe this is a sacred ministry? Do you believe it is a calling? And do you believe maybe this is one reason you were put on this earth, to work in healthcare, to improve the care for the Native Americans? And then a good culture has a recognizable brand, as I said, externally. People see your mission, vision, and values by the way they observe you each and every day. They understand why you're on a roadmap to excellence, because you can show where you were last week and you can show where you are next week. And we heard Mr. Merle talk about many of the improvements that are occurring. You use a balanced scorecard, measuring these metrics for oversight and decision making. You work with your physicians to try to integrate them, and we know this is a challenge at times, but I think more and more physicians are realizing they can no longer be your customer, but they must be your partner, and it requires strong teamwork, carrying out the 14 attributes of teaming that I've reviewed with the facilities that I have been able to work with over the last year and a half. Next slide. So the final components of the culture are an organizational ethics. You must have a strong moral compass. Don't ever do something that's not right, whether it be at the clinical bedside or if it's in the administrative processes. And don't retaliate against people who are pointing out concerns. We all don't know what we don't know, and healthcare is very complex. So if you are facing something you don't know, ask for help, and don't really tell things that are not correct and retaliate against people that are pointing their concerns out. Take it as a constructive feedback loop and continue to improve. I talked about the palpable passion, and I hope you all have it. And remember, again, I've already said, your work is a sacred ministry. This is a calling. And last time we told a story asking the question that I've asked myself about 70 times in my career. Could this be one of the reasons I was put into healthcare? Any of you could work in any other industry. I assure you, you can. But healthcare is very special, and I hope you remember that each and every day. Next slide, please. Next slide. Great. Now, one of the things that I wrote almost in 2004, so we're talking almost 14 years ago, I said, always remember, having a thriving culture filled with joy in the workplace is not just about winning the war. We win lots of wars in healthcare, but at the end, it's not good. And this is what I said, and I hope you listen to it. It's also in our book, Breaking Out of the Healthcare Abyss. Clearly, at the end of each day, the culture of the organization and joy of its people are how the day was lived out, about how the war was fought, and how the endpoint was achieved. A thriving culture does not mean that strategy and operational outcomes are not important. However, even with a poor culture and hopeless environment, the organization can still win the war. I've seen many organizations that have won the war filled with hopelessness and with little good culture and little good joy. But in those scenarios, in the end, many people will be killed in the process, disillusioned and disengaged, with diminishing commitment to the mission and values of the organization. And remember, if you don't remember anything else today, if many of the good people have been lost, celebrating the victories become hollow. Healthcare does not occur by one person. It's a team of persons who must celebrate the victories to energize them to move forward on the continuous improvement journey. And most importantly, if the victories become hollow, there will be many less willing to fight the next battle. The sign your culture is dying and excellence is no longer achievable. If you call upon people to help you and you turn around and there are very few volunteers, be really sensitive to what this means. And remember the last time I told you, you can't be a leader if you don't have followers. And if you have a cultureless organization, an organization filled with hopelessness, rather than a thriving culture filled with joy, when you turn around and look behind you, there may be no one there to follow you. That's not what you want to do as leaders in Indian Health Service. You want to get people behind you, marching, hearing the drums, and hearing the tune. Let's move on. Let's be excellent. Let's thrive. Next slide, please. And so let's close here by remembering there is a need for a thriving culture because we can't treat patients with the value equation, improving excellence, safety, accessibility, service quality with patient, employee, and physician satisfaction while we're trying to control our costs if we are not in an organization that has a thriving culture filled with joy. And the what is it? I've told you there are many signs of what a thriving culture is. I hope that you'll have seen many of these signs in your organization, but I think that's where we need to focus on to determine where we are and what further things we need to do, which we'll discuss the next time, to improve that culture and joy in the workplace. The feeling about people and that they have about what they do is most important. And I think we heard Mr. Merle say that again, this is very important work and we need to feel good about it. And we can't have hopelessness because it does cause burnout, as we've heard. And burned out patients or employees do not serve the patients well. How a thriving culture with joy in the workplace is going to be implemented, we're going to learn much more about that in Series 2. It can be done, and I'm sure you're doing key things already. And this knowledge about joy in the workplace will actually link very well with the upcoming LANs because you're going to be talking about emotional intelligence. You can't have a good emotional intelligence in an organization that does not have a good culture. You can't coach and influence and motivate people unless you are yourself working in a thriving culture. And you can't create a culture of safety and quality unless you are working in a culture of joy and a culture that is focused on the good things. So there is no question the people who wrote that culture trumps strategy are actually people that were on target and knew what they were talking about in the past. And I will tell you today, culture does trump strategy. So in the end, if you're going on a journey to excellence, if you're going to continue the improvements we talked about, if you're going to be the leaders that you need to be, and your staff is going to feel good about working under your leadership, you are going to have to do everything possible to make sure that all you are doing is building on a foundation of a strong culture. And if you have that strong culture, it will absolutely high and create joy in your workplace and will create the right motivation to move forward. Again, I hope this is helpful as we go into our breakout groups to determine where are you as individuals and your organization as we look at this topic, recognizing without it, we will not be successful, but with it, we will be a growing and thriving organization. Thank you.
What I'd like to do is call on each breakout room to give a quick report out, just about a minute or so, and then Dr. Royer can give some color commentary as well. So we'll start with the first breakout room, which was facilitated by Ursula.
Okay. Well, we had a great discussion, and we were still discussing and sharing information as the breakout room was coming to a close. But the information that I had gathered from the discussions was being transparent, trust, having that communication across the board from administration down to our staff working with the patients, even including the patients in sharing the information on the goals to help them get better. Teamwork. We realized that there's a lot of different personalities working, and so there's different learning aspects that each person has, and just try to gather that information and learn each person and how to explain it a little bit more to them so that they have that information, and just to from there to provide excellent care and have an excellent service.
Great. Thank you, Ursula. And you'll notice in chat, there's also some additional comments coming through. Dr. Royer, is there anything you'd like to add? Did we lose Dr. Royer? Let's go ahead and head into our second breakout room. Natasha.
Hi, could my representative go ahead and do our chat? Arts, are you still on? You'll just have to unmute yourself.
Are you asking me, Natasha?
Yeah.
Okay.
Yeah.
Hi. One of the things I did, I've been in the Indian Health Service for almost 33 years, and of course I've been there has been times when you have difficulty with employees and trying to make them work together. At one time I sat down with employees and I told them, I said, you know what, we're here at work more than we are at home, so we need to get to like each other. And so I encourage my employees that if they have difficulties with each other or have issues, to go to that person one-to-one and to discuss the issue. And if that doesn't work, I told them I'm always here to step in if you need me. But I said, if you come to me first, we're still going to have to go back to the other employees. So I recommend going to the employee first if you feel comfortable, and not then coming to me, and then we can meet as a group. We try to work our issues out. I encourage people to have a respect for the employees, even though we don't always agree on our decisions or issues at work. Sometimes people can bring problems to work, and we need to sit down and discuss that with, if you've got problems at home, you need to keep them out of the workplace. But, if we are spending more time bickering and not getting along and not communicating, that takes a lot of energy out of our workplace. And so if we're going to be productive, we need to be happy and we need to be working.
Thank you so much for that. We're talking about what are some things that we've done to try to increase that transparency to help promote that safety culture, that communication barrier that we sometimes have in the workplace, to get to that perfect world and to get to that culture that we'd like to see. So thank you. Great job.
Thank you. Breakout room 2. And Dr. Royer, I'm going to ask that you maybe hold the comments or put in chat your comments until the end, just so we have time to hear from everyone. Breakout room 3, Jimmy.
Yeah, we put some of our comments in chat. Mary Erickson did. She's up in Montana working with Fort Belknap. The growth future there looks exciting. In the department of how do you describe culture in your workplace, everyone is important and every role is important. So everyone is recognized for the roles and what they do. And then also it's like a family. It's like one big family. Fort Belknap, they say they're a work in progress. Other service units say their department fosters a supportive independence. We are allowed to work and grow professionally. We do have a team and do not feel there is a loss, and we have a good, stable workforce. And some of the what would your workplace culture look like in a perfect world? It would be respectful, kind, caring, compassionate, honest, and trustworthy. So,
great.
Thank you.
Thank you, Jimmy. Next up, we have Katie and Marie. I also see that you've put some in chat. So do you prefer just to report out in chat, or would you like to speak up?
This is Katie, and you guys can basically read in chat too. The biggest thing that, that was maybe a little bit discussed in our room was just, it was basically the perfect world, and I don't know if there is one, but we can always be better about just, trying to avoid the rudeness and the arrogancy and all those things that play in to our workday that affects us personally and prevents us from having personal success, enjoying our work. But you can read the comments. But I think it's just like the common courtesy of respecting others, as well as kind of the golden rule of just being nice to others, and then how we talked a little bit about how that affects our patients and our culture and our basically what we do. It does affect our patient and our patient care.
Mm-hmm. Great. Thank you so much, Katie. So next up, we had Kim and Mary Helen, and they said that their responses are in chat. So please take a look at review those from Mary Helen. And our last breakout room, Silka and Francesca.
Hi, Dion. So we had the phone breakout room. We had a group from SUNY. We had Rochelle from Red Lake, and we had Fred Fredrickson and a couple of others who were on the phone. And really what we were discussing was, the last question was, what would your workplace culture look like in a perfect world? And I think the comments across the board were really, being able to walk into work and seeing your staff members and teammates that are happy to be there, that no one is down or upset about having to go to work. And that when you walk in, you're walking into somewhere that is a positive place to be.
Great comments. Dr. Royer, did you have anything to add? Are you back with us? Okay. All right, so Dr. Royer, if you are muted, you might have to unmute yourself on the computer. And we're very close to being at time, so I'm going to go ahead and wrap up, and then if we have Dr. Royer able to rejoin us, we will do so. He will. Oh, go ahead. Are you back? Go ahead.
Yeah, I would just say that, remember, we are talking about culture and joy in the workplace because it's the only way we have what we need to have to give to our patients so they receive excellent care. I would give you some homework. Certainly you came up with many attributes of what you consider a strong culture and joy in the workplace to add to the list that I presented. What I would ask you to do between now and our April 11th LAN is to do a culture assessment in your next team meeting on a scale of 1 to 10. Where do you believe you are on a thriving culture that creates joy in the workplace? And come up with some things that would move that number further up the line, closer to 10. And then next time we'll see what those plans look like in comparison to the plans that I will present as to how we do it, how I think you can do it in the LAN part 2. Again, thanks for having me, Dion.
Thank you. So I do have just a couple things to wrap up. So a reminder, Dr. Royer will be joining us next month. It will be on our normal day, which is the second Wednesday of every month, to continue this discussion. And I do have, if you have time, a quick rapid feedback. We'd like to hear just how this session, this topic worked for you. I've put a poll up, and you can answer as a group. We will also send this link to individuals as part of our follow-up. It is also in chat for you. Very curious how you felt that the topic applied to you, if it was relevant, and how the format is working for you. Again, I mentioned we're doing a PDSA as we go to see what resonates with folks and what's the best. We are trying to get it into that 60 minutes time frame that was requested, and we almost made it. So I will invite you, we'll keep the chat open. If you have questions, I've seen a couple questions come through. We will follow up with individuals or address next month at our LAN. We will follow up with an email with a link to the resources and a reminder for our next session. And again, the link for our evaluation for feedback. So thank you so much for your time, the great discussion and comments. Please reach out to me in email if you do have any additional questions or comments to get to us. I'll be happy to respond. Thank you again for joining, and we will see you next month. Have a great day, guys. Bye-bye.